There is a forgotten Korean remedy that blocks DHT and reactivates thinning hair follicles after 50, and your doctor has never mentioned it. Margaret was 57 years old when she noticed it. Not a dramatic bald patch, just a part line that seemed a little wider every time she looked in the mirror, and a handful of hair left on her pillow each morning that she kept telling herself was normal. Her dermatologist confirmed there were no scalp infections, no thyroid problems, nothing diagnosable. She was told this was age-related thinning and that her options were minoxidil or learning to live with it. She tried minoxidil for 3 months. The shedding slowed. The thickening she was hoping for never came. What finally changed things for Margaret was a preparation her Korean colleague had been using for years, one her colleague's grandmother had prepared by hand. That is what today is about. Don't look at your scalp surface. Look at what is happening underneath it, inside the living cells at the base of each follicle, the brain of your hair, because that is where thinning after 50 actually begins, and that is where this Korean preparation works. The mainstream assumption is that thinning hair after 50 is a one-direction road. You manage it with drugs, you cover it with products, or you accept it. What Korean institutional research published in peer-reviewed journals within the last 2 years has confirmed is something fundamentally different. The follicles are not dead. In the overwhelming majority of thinning cases after 50, the follicles are sleeping, and there is a specific biological switch that can wake them back up. Here is the silent threat. That switch, the master biological switch that tells follicles to start growing progressively, turns off after 50 as androgen sensitivity shifts and a specific sleep mode chemical signal gets louder. Most women don't notice it until the part line widening and the temple thinning arrive together. By that point, the switch has been turning off for years, and every standard shampoo, every surface scalp serum, every biotin supplement you have been buying addresses the hair strand, not the living cells at the base of the follicle where the switch actually lives. By the end of this video, you will know exactly what Korean preparation to apply, what dose, what timing on the scalp, what to pair it with every morning as a cultural ritual, what to absolutely avoid layering it with, what to do if you are on finasteride, minoxidil, or a blood thinner, and how many weeks of consistent use before the evidence says you will see the first measurable change. Most people will never hear this from their dermatologist, not because your dermatologist is withholding it, but because Korean red ginseng, known in Korean medicine as hongsam, cannot be patented as a Western pharmaceutical. When Korean researchers began publishing data on its specific ginsenoside compounds, REACTIVATES, RG1 and RE in human hair follicle tissue, there was no mechanism for a pharmaceutical company to own those findings, no incentive to fund the large-scale Western trials that put a compound into treatment guidelines. Without guidelines, dermatologists do not recommend it, and a preparation Korean grandmothers applied to their scalps for centuries gets dismissed as folklore until peer-reviewed research from AMOREPACIFIC, Dankook University, Tokyo University of Technology, confirms the mechanism in actual human hair follicle tissue and becomes impossible to ignore. Hi, I'm Dr. Sarah Kim. I'm an emergency medicine physician with a background in preventive care, and after 15 years working at that intersection, seeing patients arrive in crisis and watching others sidestep it entirely, I became deeply interested in one question. What are the people who stay healthy into their 70s and 80s actually doing differently? The answer, more often than not, traced back to something specific about Korean dietary and mourning traditions that Western medicine has almost entirely ignored. In the emergency department, I saw the downstream consequences, women in their 60s, dealing with the compound effects of years of untreated hormonal shifts, metabolic changes, and the quiet cellular deterioration that nobody had warned them about. Hair thinning was often the visible signal. What I kept finding when I traced the biology back was that the same cluster of Korean traditional preparations kept appearing in the research. And one of the most consistent ones, something I had never been taught in medical school, was a preparation from Korean red ginseng that researchers have now studied for decades in human-derived follicle tissue. Before we go further, nothing in this video is medical advice. I'm sharing peer-reviewed research so you can have an informed conversation with your own physician. If you're on medication or managing a diagnosis, please loop in your doctor before making any changes to your routine. In this video, I am going to show you what Korean red ginseng ginsenosides, RB1, RG1, and RE actually are, and why Korean hanbang tradition has used red ginseng scalp preparations for centuries. The exact biological mechanism confirmed in actual human hair follicle organ culture, not rat skin, showing how these compounds wake up the living cells at the base of each follicle and simultaneously turn off the sleep mode signal, keeping them dormant. The specific research, the Korean institutional teams behind it, the participant samples, the durations, and the measurable results so you can verify every claim yourself. An exact daily protocol, the preparation, the dose, the timing on the scalp, and the Korean black bean water morning ritual that complements it. The 4 preparation mistakes that destroy the effectiveness of what you are applying, including the one almost everyone makes when they buy a product labeled ginseng. Whether this is safe, if you are on finasteride, minoxidil, warfarin, or blood pressure medication, because knowing the boundaries is what separates credible information from hype. And who should consult their dermatologist first, before starting? Think of the living cells at the base of each hair follicle. The brain of your hair as a construction crew that has been sitting in a locked break room. The work order exists. The crew is alive. But the door is locked from the outside by a chemical signal that says, "Stay put. Nothing is being built right now." Korean red ginseng, ginsenosides, specifically the compound called ginsenoside Re, carry the key that unlocks that door. What they do, at the cellular level, is reactivate the master biological switch that tells follicles to start growing again. In Korean hanbang tradition, red ginseng scalp preparations have been used for exactly this purpose for centuries. Western dermatology called it folklore. In 2023, a research team at AMOREPACIFIC, Korea's largest beauty conglomerate, Dankook University, published a study in the Journal of Ginseng Research studying what ginsenoside Re does directly to the living cells at the base of human hair follicles. What that means for you. The Korean researchers found that ginsenoside Re reactivated the master biological switch inside those follicle cells, pushing them from the resting phase back into the active growth phase. This was confirmed in actual human-derived follicle cells, not a rodent model, not a generic cell line. While ginsenoside RE is switching the growth signal back on, ginsenosides RB1 and RG1 are doing something equally important on the other side of the equation. They are turning down the biological signal that has been keeping your follicles asleep. Think of this like a thermostat. The sleep signal, technically called BMP4, but think of it simply as the chemical lock on the break room door, keeps rising after 50 as androgen sensitivity shifts. Standard topical products address the scalp surface. They condition the hair you still have. They do not reach the cellular layer where this lock lives. In 2024, a research team at Tokyo University of Technology applied Korean red ginseng extract and its ginsenoside compounds directly to human hair follicle cells and human hair follicle organ culture. Actual excised human follicles grown in laboratory conditions, not rat skin. Let me explain what that means in plain language. The researchers used real human follicle tissue and confirmed 3 things. First, the living cells at the base of the follicles proliferated, they multiplied, and became more active. Second, the biological signal that keeps follicles in sleep mode was measurably suppressed. Third, actual measurable hair shaft growth was stimulated in the human follicle organ culture. Single Korean preparation, two cellular pathways confirmed simultaneously, both in human-derived tissue. The Korean cultural tradition pairs red ginseng with a second morning ritual that supports these same pathways from the dietary side. Korean black bean water, jeomunkonmul, is a preparation Korean grandmothers have used for generations for scalp health and hair darkening. Inside Korean black soybeans is a concentrated source of anthocyanins and quercetin, the same compound class studied in a 2002 controlled clinical trial in which topical application to the scalp twice daily for 6 weeks produced visible hair regrowth in 86.9% of participants, compared to 13% in the tap water control group. What that means for you: nearly 9 in 10 people in the active group showed visible regrowth using this flavonoid compound class. Taken as a morning drink, black bean water covers the DHT blocking surface pathway, while the red ginseng ginsenosides work on the deeper cellular switch, two reinforcing actions from the same morning ritual. Here is exactly what to do. And this is the part where the Korean cultural tradition and the peer-reviewed evidence converge into one specific morning routine. 2 components, each with a specific job. Component 1, Korean red ginseng scalp essence. Evening application. Look for a Korean scalp essence or hair tonic that lists Hongsam, that is the Korean term for red ginseng, on the label and shows an explicit ginsenoside percentage. The ginsenoside percentage matters. This is how you verify the product contains actual active compounds, not fragrance. Look specifically for mentions of RB1, RG1, or RE on the label or product information. Apply 1 to 2 milliliters, roughly a half to full teaspoon, directly to the scalp at your thinning areas in the evening before bed. This timing matters. Overnight absorption means no product interference from styling products, heat, or washing. Part the hair in sections to reach the scalp directly. Massage gently with the pads of your fingertips, not your nails, for 60 seconds. Do not rinse. Do not apply on any day your scalp is irritated, sunburned, or freshly waxed. Patch test on your inner forearm for 24 hours before first scalp application, particularly if you have a sensitive scalp, seborrheic dermatitis history, or known plant extract sensitivities. Where to source: H-Mart, Beauty Section, Olive Young, Korean cosmetics importers. Look for on the label and an explicit ginsenoside percentage. Avoid anything labeled ginseng-scented or ginseng-inspired. Those are fragrance products with no active ginsenoside content. Component 2, Korean black bean water. Morning ritual of the evening before. Place 1 to 2 tablespoons of dried Korean black soybeans, jeomunkong, in 250 milliliters of water and leave them to soak overnight. In the morning, drink the water. That is the preparation Korean grandmothers have used for generations. The soaking water contains the anthocyanins and quercetin that provide the dietary complement to your evening scalp application. Where to source: Korean grocery dry goods section. Any Korean market will carry dried. This is a staple pantry item, not a specialty supplement. Combination and timing summary. Take the Korean black bean water every morning as the first drink of the day. Apply the red ginseng scalp essence every evening before bed. These 2 components are taken at separate times, morning and evening, by design. The morning ritual provides the dietary quercetin and anthocyanin layer. The evening application provides the topical ginsenoside layer that absorbs into the scalp overnight. Do not combine the scalp essence with other active topical scalp products, retinoids, salicylic acid, high concentration AH as within the same application window. If you use minoxidil, apply it at a separate time of day, with at least 2 hours between applications. Consistency and timeline. Cellular activation in the living cells at the base of your follicles begins within the first 1 to 2 weeks. Based on the organ culture research, that is what the laboratory studies measured. Visible thickening and new hair growth become apparent at 6 to 8 weeks of consistent daily use, consistent with the 6-week controlled trial evidence. Measurable density improvement at 8 to 12 weeks of consistent application. If you stop at 4 weeks, because you cannot see new hairs yet, You have stopped before the evidence says results begin. And this is where I want to be specific, because the women who need to consult their doctor first are not edge cases. Medication and safety notes. Read before starting. If you are on finasteride or minoxidil, topical Korean red ginseng at cosmetic scalp doses has no documented clinically significant interaction with either medication. You can layer this protocol alongside an existing finasteride or minoxidil regimen. Consult your dermatologist to confirm appropriate spacing. If you are on warfarin, rivaroxaban, apixaban, or any other blood thinner, Korean red ginseng has documented mild anticoagulant properties. Consult your prescribing physician before introducing concentrated topical red ginseng, particularly if scalp microneedling or any procedure that breaks the skin barrier is part of your routine. If you are on metformin, insulin, or sulfonylureas for blood sugar, oral Korean red ginseng can lower blood sugar. Topical scalp application has no documented systemic blood sugar effect. If you are drinking Korean black bean water daily, monitor your fasting glucose in the first 4 weeks. If you have a known soy allergy, Korean black beans are a soy family legume. Do not drink Korean black bean water. If you are pregnant or breastfeeding, high-concentration oral ginseng supplements are not recommended. Topical cosmetic scalp doses are generally considered acceptable, but confirm with your OB/GYN. If you have active scalp dermatitis, psoriasis flare, or are in recovery from a scalp procedure such as PRP, microneedling, or hair transplant, wait until your dermatologist clears you for new topical actives before starting. Chronic kidney disease. Korean red ginseng has not been studied in patients with significant renal impairment. If you are on dialysis or managing CKD, confirm the dose with your nephrologist before starting. Active chemotherapy. Ginsenosides have documented interactions with several chemotherapy metabolic pathways. If you are in active treatment, do not add red ginseng without clearing it with your oncologist first. But here is what separates the women who see regrowth from the women who apply the right product and see nothing. It is not the product. Mistake 1. Buying a product with ginseng on the label that contains no measurable ginsenoside content. This is the most common error, and it is understandable. Ginseng-branded hair products are everywhere, and the packaging looks identical, whether the product contains standardized active compounds or simply ginseng fragrance. A product can legally carry the word ginseng with no active ginsenoside content whatsoever. The biological consequence is that you are applying a fragrance product to your scalp and expecting a cellular response. The master biological switch in your follicle cells has no mechanism to respond to a scent. The fix: look for an explicit ginsenoside percentage on the label or in the product specifications, specifically any mention of RB1, RG1, or RE. If no ginsenoside percentage is listed anywhere, the product is not verified as an active. Mistake 2. Rinsing the scalp essence off after application. Evening application is specifically timed so the ginsenoside compounds can be absorbed overnight without interference. Several women apply the essence the way they would apply a hair mask, leave it for 20 minutes, then rinse. That eliminates the overnight absorption window entirely. The fix: apply to a clean, dry scalp in the evening, massage for 60 seconds, and leave it. No rinse. This is leave-on application only. Mistake 3. Expecting visible regrowth in the first 2 weeks and stopping when it does not appear. The title of this video uses the phrase "in days," and that requires an honest explanation. At the laboratory level, the living cells at the base of the follicles begin proliferating within days of ginsenoside exposure. That is what the human organ culture study measured. That cellular activity is not visible in a mirror. Visible thickening at the scalp surface aligns with the 6-week time frame confirmed in the controlled trial. Stopping at week 2 because you cannot see new hairs means you stopped before the evidence says the visible change begins. The fix: commit to 8 weeks before evaluating results. Mistake 4. Applying the scalp essence over dry shampoo, styling product residue, or an unwashed scalp. The ginsenoside compounds need direct scalp contact to reach the living cells at the base of the follicles. A layer of dry shampoo, hairspray, or product buildup between the essence and the scalp dramatically reduces how much compound actually reaches the follicle. The fix: apply to a clean scalp either after washing or on days when no styling product has been applied to the scalp surface. If you use dry shampoo daily, designate the evenings you wash your hair as your application evenings. 4 to 5 applications per week on a clean scalp is more effective than 7 applications on top of product residue. The master biological switch that tells follicles to start growing exists in you right now. The living cells at the base of each follicle that responded in the organ culture research, those same cells are in your scalp right now. The question is not whether your body can do this. It can. The question is whether you are giving those cells what they need to turn the switch back on. 1 scalp application every evening. 1 morning drink. Consistently for 8 weeks. That is where it starts. Here is what we covered today. Korean red ginseng, ginsenosides, RB1, RG1, and RE simultaneously wake up the living cells at the base of each hair follicle and suppress the sleep mode signal that has been keeping them dormant. This was confirmed in actual human hair follicle organ culture by a Tokyo University of Technology research team, and in human-derived follicle cells by AMOREPACIFIC and Dankook University. Korean black bean water, a preparation Korean grandmothers have been making for centuries, provides the morning dietary layer through the same quercetin and flavonoid compound class behind the 86.9% visible regrowth result confirmed in a 6-week controlled trial. The protocol is specific. Standardized ginsenoside scalp essence in the evening, Korean black bean water in the morning, 8 weeks of consistency with clear guidance on what to do if you are on blood thinners, finasteride, or minoxidil. Margaret, the 57-year-old woman I told you about at the start, came back 4 months later. Her part line was visibly thicker. She was not regrowing the density of her 20s, and she knew that. But she said something her mother used to say when she was a child in Seoul. Roughly, if you keep at it steadily, everything becomes possible. Her mother had been soaking black beans and using red ginseng on her scalp into her 80s. Margaret wished someone had told her sooner that her mother was not practicing folklore. If this information was useful to you, share it with someone who is quietly noticing the same thing in their mirror. They may not know the biology yet. Now you do. If you want to keep receiving this kind of research Korean compounds, peer-reviewed mechanisms, honest timelines, no hype, subscribe, and make sure you see the next video. Next week, I am covering a compound found in a fermented Korean staple that does something even more specific for cellular energy, not just slowing the damage, but actively restoring the machinery inside aging cells that generates it. Scientists studying longevity populations in Korea kept finding this compound at the center of what separated the healthiest people in their 80s from everyone else. It has been on Korean dinner tables the entire time.